Hello everybody, and welcome to this presentation today on the MSc in Cancer Survivorship, and thank you to those of you who have attended the talk today. So first of all, I just want to tell you about the key features of our Masters in Cancer Survivorship, and this Masters is a very unique Masters in that it is the only available internationally Masters in Cancer Survivorship. So the first thing to know about this program is that it is multidisciplinary. So it is intended for all and any health and social care professionals who are working in the area of cancer care. And in fact, the more diverse disciplines, the better, because that makes for a more interesting program. The next thing is that the program itself and the modules on the program are being delivered by leading researchers, clinicians, and policy makers in the area of cancer survivorship in Ireland. And we're very lucky in Trinity College that we have such key people who are researching and informing the direction of cancer survivorship care and services in Ireland. The next thing is that the master's programs and the suite of programs that I'm going to describe to you, they're internationally relevant. So regardless of where in the world that you are working, the learning that you will get from this master's can be applied to any cancer care setting across the globe. And then the last key feature of the program is that we offer flexible course options. So you have an option to complete a postgrad certificate in cancer survivorship, or you can do a postgrad diploma, or you can take the full master's in cancer survivorship. So this gives students the options that maybe they might like to start off by doing a postgrad certificate in cancer survivorship, and then at a later date they may decide, actually, I'd like to go back and take a diploma. And you can do this as long as you come back to do the diploma within a 3-year period. Or you may decide that you've done the diploma and then you want to upgrade to a master's. And again, this option is available for students. So now I just want to discuss with you the overall aims of our programs, and this would cover the postgrad certificate, the diploma, and the master's. So by the end of the program, it is anticipated that any students who come on the course will be able to understand the molecular and the cellular causes of cancer, and also be able to understand the scientific basis of the range of cancer treatments that are available, and also an understanding of the side effects that can occur from these treatments. You'll be able to apply and critique evidence-based assessments and intervention approaches to manage the physical and psychosocial impact of a cancer diagnosis, and also have an understanding of the different types of treatments that are available to address physical and psychosocial difficulties. And these interventions would apply across all ages and all stages of a cancer diagnosis. You'll be able to understand the process and implementation of clinical trials within cancer research, and that's very wide and very varied, and understand and evaluate different research methods. So again, given the issues that arise for people with a cancer diagnosis, a number of different research methods are appropriate. So you'll be able to understand how and when different methods can be applied to different aspects of cancer survivorship. Also, by the end of the program, you will have skills to be able to evaluate and synthesize the ever-growing evidence base in cancer survivorship. Technology-supported interventions in cancer survivorship is a growing area. So in one of the modules will be dedicated to this area, and you will have an opportunity to examine the theory behind developing and also develop skills for applying novel innovations in cancer-related services. And the final aim of the programme is that by the end of, and this really applies to anybody who goes on and does the Masters, is that you will be able to carry out scientific research in an ethical manner and write up the results in the form of a dissertation. So you can see there from the programme aims that we really are covering all elements of cancer survivorship care. So as I was saying earlier, it's very flexible, the options on how you want to study cancer survivorship. So if you choose to start with a postgraduate certificate, you would complete 4 modules over a period of 1 semester, 1 academic semester. If you decide you want to do the postgrad diploma, you will complete a total of 9 modules over an academic year. And then for those of you who want to do a master's, you will complete those 9 modules and also complete a research dissertation. The other flexible option that we have built into our suite of postgraduate programs in cancer survivorship is that they can be completed on a full-time basis, or maybe you're already working in the area of cancer survivorship and you opt to complete the program as a part-time student. So as I say, we've really tried to accommodate anybody who is interested in doing this program. So what are the modules? So we'll start off the postgrad certificate. As I said, you have 4 modules to complete. These are the 4 modules. The first one is physical considerations in cancer survivorship. So this module specifically focuses on examining physical impairments that occur with a cancer diagnosis, but also because of the treatments involved for that cancer diagnosis. And it will consider how they impact on cancer survivorship, and specifically will look at the role of exercise rehabilitation in managing physical concerns. Psychosocial considerations in cancer survivorship is the second module. And as the name suggests, this module examines frequently encountered psychosocial difficulties experienced by people with cancer and also by family members, because as we know, cancer isn't just a diagnosis that affects the person with the cancer, it has an impact on all family members. And again, this module will examine evidence-based interventions that health and social care professionals can use to address psychosocial issues. The next module is site-specific cancers, scientific and clinical perspectives. So the aim of this module is to provide a fundamental understanding of the scientific and clinical aspects of site-specific malignancies and also the treatments associated with those malignancies. And then the fourth option within the certificate is clinical trials and health economics. So, as the name suggests, it will examine methods for conducting oncology-related clinical trials and also basic introduction to health economics associated with clinical trials. So that's your 4 modules for the postgraduate certificate. If you want to do a postgraduate diploma, you'll do those 4 modules plus 5 additional modules. So the first 2 modules there are related to research methods. So you've got 1 module that will cover the range of qualitative methods, and the second module will address the range of quantitative research methods with a particular focus on statistics. The third module is evidence synthesis in cancer survivorship. And as you know, there is a vast increase in the amount of evidence now available in relation to cancer and cancer survivorship. So this module will help you to develop the skills to be able to synthesize and evaluate that evidence and examine how that might apply within your own practice. The next module then is innovation in e-health. Again, an area that's developing exponentially, and therefore this module aims to help students develop knowledge and understanding of innovative methods for developing and delivering digital health technologies. And then the fifth module, additional module within the postgrad diploma, is implementation science. And this is an introduction to the theory and practice of implementation science. How, as healthcare practitioners, do you take the evidence that you read about and implement it within your own practice? So it provides frameworks and structured methods for implementing evidence into practice. So they're the additional 5 modules. So that's a total of 9 modules if you wish to complete the postgrad diploma. However, if you wish to attain a master's in cancer survivorship, you will complete the 9 modules that I've already outlined, but in addition to that, you'll also be required to complete a research dissertation module. And the overall aim of this module is that you are synthesizing the learning and skills from the other 9 modules and taking those forward to be able to complete an independent research project in the area of cancer survivorship. And you have an option on how you want to do this. So you may decide you want to carry out an actual research study, probably small scale because time is limited. You might want to collect data within your own practice setting related to an area that you have been curious about, or maybe an intervention you're developing or implementing and you want to test that intervention. So that would be the small scale study. Or your other option for the MSc in cancer survivorship is that you can carry out a systematic review. And again, you remember one of the modules focuses specifically on the skills required to review the evidence. So a systematic review of an intervention that you're interested in, or a systematic review of an assessment method, or of a particular policy, or a particular cancer treatment. So again, we've tried to make the research dissertation module flexible to suit your needs and what it is that you want to find out about and research, and also what specific research skills you as a practitioner would like to develop. So that is the overview of our cancer survivorship program. As I say, a key strength of it is the fact that it is multidisciplinary. We want to bring together all health and social care professionals who are working in the area of cancer survivorship so that they can learn together how to optimize the care for cancer survivors. So thank you very much for tuning in and listening to the overview of the program. I'm Deirdre Connolly and I'm the director of the program. This is our website here that you can get more information on the program. And also we're very, very happy always to receive any inquiries. So this is our email address. So please feel free to contact us at any time. Thank you.